Are we live?
We should be right.
Are we good? Hi guys.
No,
No?
no, right.
Okay. Hi guys.
How's it all going?
Welcome to our AMA on the 31st of August 2019. Thanks for joining us for this one. We'll just check the audio first of all.
Yes. Please shout if you can hear us. Say something on the chat. So we know. Oh yeah, we've got a few rockets, so that should be okay.
Is that a good start?
Yeah.
Right, so we are hoping during this AMA, similar to the other AMAs, normally lasts about half an hour, we will answer some of the prepared questions that we had sent in via the Telegram group, via email, and our other social media as well. And then obviously we want to take some of your questions, but maybe it'd be worth doing the questions after we demo the product. So what we have here is Mo's worked hard to set up the web browser and the mobile phone to display what myclinic.com looks like now, and essentially what we're taking to clinics in the UK and abroad and showing them what our product looks like now.
Yeah, so we want to show you a preview of MyClinic. Now, as you know, MyClinic is only one part of the roadmap, but it's something that is complete from outside and is actively being tested by various clinics at the moment. It's also not the full product, so we still have the health platform that we'll also demonstrate to you in the coming months, and that's fully utilizing blockchain. Obviously, this is using some of our blockchain as well and the token utilization. So this is just a small preview, and there'll be much more to come in the future. And I guess a lot of people have been asking, where are you with the project, how's it going, etc. So I think for the sake of transparency, it's good to show you where we are and to show you what we have developed so far. So if we now switch to the MyClinic application, and in true YouTuber style, you'll see able to see us while we're doing this. So Abdullah can go ahead and demo what we're looking at right now.
So right now I am logged into the web browser of myclinic.com. So this format is tailored for doctors as well as for administrative staff. So what I mean by that, I'll just nick your mouse.
Yes.
If I come across here, essentially I'm logged in as a clinician, but I can switch that also to an administrator role. The idea of the administrator role, if you look at the top where it says dashboard, schedule, patients, when I switch to administrator role, I get other functions such as staff and services. So the idea of the myclinic.com solution which we built is that this is a fully working booking and scheduling service for different clinics offering different services to connect directly with their patients. And the idea when we come onto the mobile phone application, which I'll be doing off an Android, but there is obviously an iOS one as well, is the idea is how the patients interact with these different clinics, seeing different appointments available to them as well. So I will show you going back. So for example, this is me as one of the doctors at a clinic called The Groves. If I was a doctor at all these different clinics, I could choose different ones. The reason this is set up with these names is these are the clinics in Leeds, which is a city in the north of England that we were targeting to try to get our product out there, and we're still in discussion with them at the moment. And here's where the different doctors would be listed as well. Obviously a lot of these are test doctors as well. What you're looking at here is what available appointments that have been made. So for example, we named this one the AMA clinic, and going through the different slots, I can look if there were lots of doctors going across, what other team schedules they have as well. If there are lots of live patients registered to this system, then it comes through as well. But obviously this is a demo system, so all these patients are made up, if you will. So the thing that I want to demonstrate to you really is obviously the appointment slots, making an appointment. So you see all of these are available. And what Mo can do for us is he can switch us to the mobile phone. I can make an appointment, and you should see that come up live as well on this.
Okay. So now we've got, we have a phone here. Test it, make sure it's working.
Yep, so going to the myclinic.com app, so that was the one right in the middle there. You're greeted by different panels, and these panels are always being modified and added on.
And this is the patient's view now.
This is the patient's view, yes.
So what we demonstrated earlier is the doctor's view.
Exactly. So the doctor's view, we expect them to be at workstation, at their own personal computer. we are working to expand that beyond a web browser on a laptop onto an iPad and then eventually onto a phone. And with the patients, it's the opposite. So we're starting off with a mobile device and then expanding to an iPad and then a web browser if patients wanted to use it that way. The different panels you're greeted with here are the different available services. So for example, you could look for a particular specialist, you could look for a nurse, appointment, for example, for travel vaccinations, and eventually the panels that will come underneath this will be for genetic testing, for example, or if there's other services out there such as physiotherapists as well. One of the other things to mention as well is that a very big thing that's happening in healthcare today is what we call a symptom checker. And essentially what the symptom checker is that clinics are now wanting patients to triage themselves through a decision tree, if you will, and then come to the conclusion whether they could manage this themselves or do they actually need to see a doctor. And this is something which is now really becoming a requirement in the National Health Service in the UK, and I think other countries will follow suit and follow this trend as well. So that's something we're also working on. But for the purposes of sticking with this example, so you'll see if you look at the web browser, that Dr. Abdullah Al-Biati is under the Groves, and we can see some appointment slots available for them as well. I will just move that to a time which is more suitable because it's now 10 AM here in the UK. So we'll come to these ones. For example, if I open the GP appointment slot, I can choose in which format I want to see the doctor as well. So again, the whole drive or premise of Medicalchain as a company is we want to remove health barriers. That's not just in terms of having access to your medical records, but in terms of how you access your health services. So as you see, we are pushing for phone calls, in-person, home visits, and of course the telemedicine side. If I click on the telemedicine, I'm wanting to see this doctor at my clinic called the Groves. I can see the appointment which is available for that clinic. It's asking me which doctor would you like to see, or do you want the first one available? So I'm saying I'd like to see this doctor. I'd like the 10:15 appointment, please. But obviously I could look into the afternoon or other dates at top if they became available. I can book and confirm. Now obviously this is the bit that most of you in the AMA would be interested in, is knowing how we are utilizing med tokens. So this has already been plugged into everything that we're doing with myclinic.com and the other applications that Medicalchain will be producing as well. So you choose med tokens, it talks about what the current rate is and what that appointment would cost, and then you'd go ahead and pay. And if I draw your attention back to the web browser, you'll see that Barra Mustafa, which is the test patient I have on my mobile phone, has now confirmed the slot at 10:15. So it happens that quickly, that instantaneously. If I go to the top of the web browser and I switch the doctor out of the admin mode and into the clinician mode, you will see that join a call has now become available. And from the patient's mobile phone perspective, I can also join the call here. So I'll switch it on. We might get a bit of loop feedback with all the cameras going on. Right. So I'll only do that for a little bit and then we might switch it off. So this is me now as the patient joining. So obviously that's me. There's Mo, sat down together. And now as the doctor, I'll also join the call. And yeah, of course we'd allow that. And now this is a loop feedback. So we'll just hang up. Or we can mute. So instead what I've done there is I've muted things because I wanted to show you another great feature of this is that you can create a report on the fly. So while the doctor is talking to the patient and looking at, for example, their skin lesion or trying to assess the patient's child, the doctor can be typing up the report, anything they want to, and then they'll instantly get put in the patient's records as well. So what I'm showing you here is a very, very quick demonstration of what we've built. It's a very complex system because of everything that it plugs into and all the different APIs that it uses. And obviously there is the blockchain element as well for the added layers of security on top of this as well.
Now it also means that when the doctor has access to these records and they're putting in this information, when that patient goes on to another doctor to speak to at another clinic, all of that information goes along with it. And we are using blockchain in the background to manage the permissions of that information, but presenting it in a very user-friendly way to the patient and to the doctor, so they don't have to worry about the keys and what's happening in the background. And yeah, this is just a very beginning really of where we're going with this, but we have a huge roadmap for my clinic and for this application. The NHS is just one entity that we are targeting. We're having some deep discussions with clinics in the US and in China on how we can take this forward. So we're actively making some good progress about this, but obviously because of NDAs and various confidentiality agreements, it's very difficult for us to disclose all this information to you right now. But we do try to give you as much as we can about it. But this is a healthcare system, so things will take time. Decisions are not made overnight. It's not like the crypto space. So at times we do find that our patients is being tested, and I'm sure it is for you as well. So you have to bear with us, but you can see here that there is a lot of progress being made in our application build.
I mean, internally we are pushing on all fronts. So, for example, I'm still working as a doctor, as a clinician in the clinic, so that I can demonstrate to people what our system looks like and encourage other doctors with me locally. I was awarded recently the NHS Clinical Entrepreneur Fellow. I don't know if any of you, so if any of you see me on LinkedIn, this is essentially awarded to doctors in the system to promote their solutions within the NHS. So it's kind of like a fast track, if you will, where you get lots of support, lots of mentorship, and lots of contacts directly to the health secretary and other decision makers in the system in order to get your solution out there. With all of this, I mean, I won't bore you because this is an AMA, this is an opportunity really for you to ask us questions than us to just tell you what's going on. But there are so many hurdles within a healthcare system, such as the NHS, let alone others. And these are procurements. Do you meet risk management? Have you demonstrated, even for example, it talks about global warming. Are you green enough as a company?
Yeah.
All these things which are not relevant to what the application does at all. But these are the things you'd expect from any kind of government to make you jump through these hoops. So as Mo says, it's a slow process. It's one that we're very deep into. And I hope as soon as we can try to show you that good news and show you who we're connected with, we will. So I think we've taken up the first 15 minutes of the AMA really demonstrating that. Hopefully that's generated some more questions, and we'll see what we've got on the list.
Yeah. Feel free to post your questions on the YouTube chat, and we do have some questions that have come through from when we asked you for, so we'll go through some of those. Now, I have to say that this is one of the reasons why we don't open the Telegram chat publicly anymore, because about 80% of the questions have been something like this. When are you on new exchanges? When Nissan GTR? When Moon? Why is the Telegram chat still closed? I mean, these questions are great to receive for comedy, but reality is we want some really good questions from you guys. We want some serious questions about this, so we'll do the serious ones. So do you want to start with the one about wearable devices? What's the development of wearable devices?
Yeah, so the wearable devices, we're still looking into the wearable device. Essentially, it's about resource management. So the wearable device would be a very good product for elderly care homes, especially in the Far East, for example, like Japan. It's a case of trying to launch this product, manage this project, and then attach on the wearable devices. Again, there are some technical issues with doing a wearable device. So I'll give you one example. We already have the APIs for Fitbit, and the idea of trying Apple Health, and the idea is trying to draw in that data directly into our dashboard that I was showing you there. The issue with it, for example, is in the UK we have different rules on medical devices, and you need different licenses. And if you import information from a wearable device into your dashboard, you need to be certified as a medical device if clinicians are going to make decisions based on that information. So there's lots of these technical hurdles, which of course we can do it. We're more than able to do it, but it takes time to complete that registration process. And as a company, our focus is on nailing this stuff first, because this is what people want. And then once that's done, all the other add-ons and bolt-ons can come afterwards.
Yeah, and to add as well, about some people might say, why are you just focusing on the UK market? Well, the thing for us is the UK market is seen globally as a renowned, prestigious medical care facility where many people from around the world come here to get treated. And because we are in the UK, because Dr. Abayati is a well-known doctor within the community in the UK, having my clinic or Medicalchain being adopted here is very important for us. It will give the project so much credibility that when we do go to places outside the UK, we can show that it is being used here by the NHS. If we can't get it used here by the NHS or by some credible UK doctors, then the expansion for us becomes a lot more difficult. And this is really why we're not necessarily trying to get this to be mass adopted by the NHS so that we can go to international markets. We are just targeting a few doctors that we know we can then go and shout about and say, those guys are using it in the UK. This is their comments, this is the feedback, this is how much optimization is provided for them and their patients. It gives us much more credibility this way when we go abroad.
Yeah, I mean, just to echo what Mo's saying there, the NHS is really one of the most renowned healthcare systems in the world, and as such, they have a very high barrier to entry for these kind of digital solutions. We are on the cusp of entering and being recognized as one of those digital solutions used within the NHS. And if you have that badge of honor, it makes it so much easier to spread elsewhere. And the NHS and the government at the moment as well does want to promote the NHS as a brand abroad. It does want to encourage health tourism, and it does want to encourage that this is the way that we practice medicine in this country and see it as a model for other countries. So, for example, there was a lot of talk on my tour to China about trying to employ the primary care services or a GP service in China, as it's practically lacking in that country as well. And these kind of digital solutions that we're building is going to act as the envelope to deliver these kind of services as well. So we have to focus on this area first. We are very close to achieving that, and I think you'll see in the coming AMAs and the coming news as well, more expansion into the Far East as well as into America. If you follow our Inside Medicalchain, which I always encourage people to do, you'll see that we talk about our tours to Japan, to China, and our connections in America as well. So they are coming, they are always there, but the hard work is really focusing and nailing this.
Okay, there's a question here about what's your experience with My Health, My Data? Have you been working on deep level with the EU on the Horizon 2020 or similar?
Yeah, so we're aware of lots of projects that are obviously very similar or have some overlap with Medicalchain. So Medicalchain or myclinic.com as the product overlaps with different health record systems, overlaps with the notion that patients should have access to their records, overlaps with telemedicine. Essentially, it's a very, very big marketplace, and it's about who does it best and who does it in a much more friendly approach. So I know about these guys, and I've heard of other ones as well. And this is not about being blockchain related. There are non-blockchain solutions out there as well. And essentially, we're all learning from each other, but there's nothing that's making us feel that we don't have the tools to just do this ourselves.
Okay. Are there still plans to switch from the token model to a model of holding digital shares? Yes, these plans are still in place. However, as mentioned before, the market right now for digital tokens hasn't really taken off as we expected it to. There have also not really been many security token exchanges where you can get the sort of liquidity that we enjoy right now on med tokens, or that you are able to use and cash out your med tokens if you wanted to. It would be a much more difficult market today if we were to move to security tokens. So for that reason, we are putting those plans on hold for the time being. But we're always open about it, and we do want to go in that direction if we could. So there's a question as well: is what kind of announcements can we expect this year or by the end of the year? Well, of course, as there are updates with the NHS, you will hear about them in future AMAs or in Inside Medicalchain. We also have several partnerships that we are lining up right now in the US and in China, and we will also keep you updated about those as and when they materialize. But at the moment it's a bit difficult to talk about them in more detail. Is there anything else we want to say right now?
No, I mean just the idea that obviously we're still very active in the community. We went to the Hyperledger Fabric annual conference in Japan, in Tokyo, where I presented on the stage there. So we're very active in the blockchain community. We're at Blockchain Live in London. If anybody wants to come and say hello at that event. I'm chairing...
That's later in September.
That's later in September. In the middle of September, I'm chairing an event of the Tech Leaders Summit, where I'll be chairing, I think it's the morning or the middle afternoon, talking about AI, blockchain, VR, AR. So obviously, we are part of that community, and we give back to that community as well. And that's just the blockchain and the tech side. From the medical side, we're always invited to medical conferences. We have two happening in December. We have one called BAPRAS, which is essentially the biggest plastic surgeon conference internationally. Yep. It's being held in Monaco this year, and again we've been invited to come and present at BAPRAS to talk about what we've been doing. And there's another one of the biggest conferences in the Far East in Taiwan, which is happening in December as well. And again, I'll be there presenting as one of the UK companies showing and demonstrating our solution. So we're very much active, we're very much exposed, and we're not hiding from any kind of questions or demonstrating what we've built as well.
Okay, so the next time you can meet us live is in Blockchain Live, where we have a stand. So,
yeah.
I'm not sure if that's a free show to enter, but it is.
I think it is
quite popular.
Yeah.
In London.
So some of the talks are very popular there, where they won't let you in. So even when standing space gets filled, you can't come in. So you need to be wary of that. But yeah, it's a free...
Blockchain Live, you can get a free pass, actually. Yeah, it's in Olympia on the 25th of September.
Do you want to answer anything from the YouTube questions? Yeah.
Fine. We've already answered.
Okay. Sure. So we've been going now for 25. Is there any new questions? Anybody wants to address anything with us? This is your opportunity. Really just to repeat, I think, what we've said in previous AMAs and what's come up in these questions. The reason we stopped doing the Telegram group is because it's a waste of time, if I can be frank with you. As a company, you already see how many different things and how many different aspects we have to work on. And when we were manning that 24 hours, we were employing 3 people to do 8-hour shifts back to back to manage that Telegram group. And it was an inefficient time of resources and manpower, because essentially they were answering questions about when moon, when this, when the other.
And blocking Telegram right now, unfortunately, is full of so much spam as well.
Yeah, completely. And it's not appropriate really to constantly, repeatedly answer questions. And I don't know any professional company, and that's what we are now. We were somebody which just started between me and Mo with an idea. We've come on in leaps and bounds in a year and a half and 2 years. We're a professional outfit, a professional company. We've got a reputation, we've got responsibilities, we've got a team with us, and you wouldn't expect this of any other company, somebody just to be sat there replying to these questions of when moon, when this, when the other. There's enough information out there that we produce on a monthly basis on Inside Medicalchain. And whenever there's an opportunity for me and Mo, we try to give you an update on the AMAs, because that's how things work. The progress is happening every day in the office, but the actual reality of trying to demonstrate that to you will only happen in quarterly or different periods of months throughout the year as well. So there's no point in just answering those questions every day, because there's nothing new to update you with. What are you doing? We're building the app. How are you doing? We're talking about partnerships.
So that, we may decide to change that in the future. So that if we're at a stage where there are more regular updates happening every day, then we could potentially go back to using Telegram. We haven't deleted the group, we just decided the group for a while.
I mean, for example, if you talk about our objective of doing the security token, for example, or trying to give back to the community there, that would be an appropriate time to open the dialogue, the Telegram group, because similar to the ICO, there were so many questions and you had to debunk so many myths and so many spams. It was important we man that 24 hours to say, look, this is actually what's happening, this is the procedure, please follow us, blah, blah, blah. We're not in that stage at the moment where we need to have that intense kind of communication with the community. So it'd just be a pointless exercise. It'd appease some people and it'd stop people accusing us of the normal things you see, but this is it, guys. When you become a proper company, a proper outfit, you have to be responsible with how you use your time and resources.
Yeah, one of the guys here says that Edith says regarding the Telegram group, it's very important to build community. Telegram moderators should be volunteers and nothing that you need to work on personally. Unfortunately, you know, you can't get a volunteer and rely on them to or hold them to account for the work that they do. We have loads of Telegram groups, there must be about 10 or 12. It really is a full-time job if you're going to manage them all, because the amount of spam, the amount of questions you get, different languages, etc.
Well, there's private medical chain Telegram groups out there.
There are. Oh, you mean like unofficial ones?
Yeah, unofficial.
Yeah, there are unofficial groups you can look for and join, which we don't have any control over. So you can have discussions there as well. You know, we do care about communities and we do want to build a community, but at the moment, we don't find that, you know, employing someone to effectively stop others from spamming the community is going to help. And what we found over the last 6 months of us running the Telegram group is we had a massive drop of people from the group because of the nonsense conversations that were going on in there. And in actual fact, we did not want to lose that community. So we decided to silence the group so they stay on, so they can actually see when there are important updates.
And of course, if anybody does have a question, you don't have to wait for an AMA. You know, I always encourage the community, if you go on our website, either medicalchain.com or you go on myclinic.com, you have all the contact information there. We do respond to emails. I personally respond to those questions as well. So if you have a pertinent question, which we haven't covered in this AMA or in Inside Medical Chain, please, you know, do send your questions. I know not everybody's watching this live, so when you have an opportunity, send us the question and give us an opportunity to reply to you.
Writer says Japanese Twitter account should be more active. The situation with the Japanese Twitter account is we had a Japanese volunteer that was translating our tweets to Japanese, and unfortunately that person decided to no longer continue doing it. So if you know someone who can help us out with that, who's interested in doing that, then please get in touch and we can do it for sure. Okay.
Right, guys, any other questions? I hope the next time we do an AMA, we can talk to you about the updates to the web browser as well as to the mobile phone device. What I really hope...
And the health platform.
And the health platform, of course.
There will be actually some updates about that, which you'll be very interested in. So maybe we can announce that in about a month or two.
Yeah, and I think we're very close to really putting the app in the stores, in the Android and iOS stores, so you can download it yourself. It'll be a demo, obviously, because you won't necessarily be connected to any clinics in your area, but at least you can play around with it. And what would be really important for us and what we'd appreciate is your feedback. So if you think something hasn't worked well, you'd suggest a different color scheme or maybe a different way to flow between the screens and the options, and please, this is the time to feed it back as well.
Someone's asking, will this project be in time for Olympics 2020? Well, it will be live for before the Olympics in 2020, and you'll be able to talk to a doctor, available to the general public. However, if you're in Japan, you've come from the UK, and you want to talk to a doctor, then you'll be able to do that. I'm not sure if it's going to be available to the Japanese market specifically, and that's only because for insurance purposes. But I can't give you a definite commitment on that right now.
I think it's definitely a possibility, but I don't think it's a probable outcome at this moment in time. Just looking at the speed which we are trying to navigate all the kind of different regulations and whatnot, to get a clinic to join us which will support patients or users going out to the Olympics in 2020, I think it'll be tight.
Yeah. Okay, thank you everyone for your time, and have a nice weekend, and enjoy the rest of your Saturday wherever you are around the world, whatever you're doing.
Exactly. Thanks again for your time and for your questions, and for those of you that are serious, please continue to ask those questions as well.
All right, thank you.
Bye bye.